Good evening, everyone, and welcome to our Lakefield College School Virtual Speaker Series. My name is Anne-Marie Key, and I am the very proud head of school and head of foundation. We're super excited to be participating in this speaker series this year, and tonight we are in for a real treat. Before I turn it over, I just want to say a few things about the school. We are in a very fortunate position to be open. As of this week, we welcomed all of our students back. We had our boarders come back as a staggered start. And for those of you who are alumni on this call, you will see we have a new entrance to our dining hall, because that's one of our safety first protocols, is really controlling where people are coming and going. So my main message is that, it almost feels normal at the school. We do have some tweaks here and there, but it's really great. And we're so fortunate to be back and learning together. And we're all doing our part to keep our community safe. The second update is, as you know, we've made a really big commitment to the well-being of our students, with everybody being cooped up so much indoors and spending so much time on screens. We really wanted to prioritize their mental and physical health. And we have invested recently in our skiing tracks. And so it's been fantastic, especially with today's snow, to see everybody out skiing. It's one of our 3 signature programs. Also, because so many people have not been able to be on campus, last fall, this is what our new residence looked like. This is happening between Rashley and the Colebrookes. And as of last week, we're really excited that we're making such great progress. And so we are still on track to have this building open in fall of 22. Couple of new things as we look to the future. The first is that we are now officially launching the design of our new dining hall. We approved a campus master plan. We approved new design principles, including regenerative design, and we're really honored that excited that we're making that commitment to regenerative. But here we are, ready to realize the vision that John and Jane Hepburn had when they made that incredible donation of $12 million. So start paying attention. We will be providing lots of updates on what this will mean for our community. And what's most important about this new project is the vision is for our whole community to come together and sit down and have a meal. And that sense of community is something that's really powerful and powerfully important to our school. The other big excitement is that we have made great progress with our Northcott property, and we are excited to be launching a pilot project this spring. We're going to be planting half an acre. We're launching some new courses and programs this summer. We'll have a co-curricular to get out to the farm this spring. And we are also engaging with a design firm, an architectural design firm, to make a plan for what the future of Northcott's going to look like. So if this is something that is of interest to you, we did an amazing webinar series with 5 different speakers, and please, if you get a chance, we jokingly say you can binge watch these webinar series instead of Netflix. It's exciting times. And finally, just my final update is to draw your attention to Grove Connect, because this is another initiative that we're really excited about. We have this incredible network of alumni from different decades who are making this commitment to work with our students and work with each other. And if you haven't yet joined Grove Connect, I encourage you to reach out to Cody McMahon or Emily Ferguson, both on this call, and learn more about it. Thanks for listening to our quick update. And next, really excited to turn things over to Sausan, who is going to introduce her mom, tonight's speaker. Thank you again for joining us.
Hello, my name is Atiyani, and today I'm honored to introduce my mother, Dr. Rola Shaheen. She's the Chief of Radiology at the Peterborough Regional Health Centre. Here are some fun facts about her. She went back to school and is currently doing her Executive MBA at Rotman. She also enjoys cooking and traveling, but she'll tell you more about herself in the presentation. Now, I would like to introduce Dr. Rola Shaheen, who will be talking about women's leadership, mentorship, and relay journey.
Good evening, everyone. Thank you so much for having me, and thanks so much for LCS community for this wonderful honor to be able to speak about women's leadership, mentorship, and relay journey. I would like to start, one second, just to see. Yeah, I would like to start by thanking Lakefield College because they have been a wonderful resource for families and students, particularly during this difficult time of the pandemic. We're so lucky to have such a team at the school that helps our students to continue with their wonderful educational experience and build on their resilience. We feel very grateful, and the amount of gratitude is just huge. So thanks to everybody. I do have wonderful three kids going to LCS, one of them already in university, Ali, in the middle here in the picture, and Sausan is in grade 12, and Miriam is in grade 9. And thank you for having us. I would like to dedicate my talk to my wonderful mentor, Dr. Stephanie Wilson. Stephanie is my supervisor for ultrasound when I was doing my radiology residency at University of Toronto. I worked with her. She shaped my career goals. She taught me a lot. And one of the most important things that Stephanie did to me one night when I was studying for during my last year in residency for my exams, I had a newborn, Miriam, at the time, two young kids, younger than 7. She called me and she said, Rula, I'd like to invite you to speak with me at RSNA in Chicago next year. For those who don't know, RSNA is the Radiological Society of North America, and it's one of the largest, if not the largest, conference in the world. And the session that she wanted me to speak at would be attended by at least 1,000 people. And to me, that was just, oh my God, amazing, Stephanie. But like, what if I don't pass my exams? What if I have to make up some time for my maternity leave and end up not going to my fellowship at Harvard? What if? And then she interrupted me and she said, stop, Rola. Why not? You will pass, you will go to Harvard, you'll finish your fellowship, and you'll see amazing cases and you'll share your experiences at RSNA. Have a good night. And she hung up on me. I think I was a different person after that call because she opened my eyes to the fact that when I am trying to pursue my goals and finish my residency in radiology and get my certificate and my license to practice, it's not just about being a radiologist. It's not just about pursuing my dreams to go to Harvard. It's actually about how to share my experiences and speaking at a conference at a large scale. And from that moment, things have been different. I was able to overcome a lot of difficulties during the last few months, and I passed. I went to Harvard. I learned a lot about women's imaging, and we presented together at RSNA, and it was fun. And she taught me how to present in the coming many other conferences. So thank you, Stephanie. We tend to meet at RSNA in Chicago every now and then. This is Stephanie with her husband, Ken, on the right in 2018. And she always insists on in taking me to fine dining to celebrate the meeting, because this is something we started when we actually, when I graduated. She said, Rola, let's celebrate watching the sunset at Canoe Restaurant. And from now on, probably we should at least meet once a year to do that. Thank you, Stephanie. I'll be talking about my background a little bit and my views on women's leadership and mentorship and how is it a relay journey. And then we're going to end up with questions and answers. In terms of my background, I have lived in many countries in the Middle East. I'm a Palestinian from Gaza Strip, from a city called Deir al-Balah, but I was born in Kuwait. I lived there for almost the first 19 years of my life, where I did go to medical school there, but after the Kuwait-Iraq conflict, I went to Jordan and finished my medical studies there. Also, I worked a little bit in Gaza Strip, after which I got married, went to Canada. I did my residency, had the kids, then moved to Boston for my fellowship and worked on faculty there at Harvard, then moved to Abu Dhabi in United Arab Emirates, where we had a great time. We lived for 3 years and then went back to Peterborough in 2015. Just a little bit about the city that I'm originally from. It's called Deir el-Balah, which means the monastery of dates. And these are beautiful palm trees, and you can see it in a lot of the backyards of many houses there, because this is what the city is named after, and it's overlooking the Mediterranean. As I said, I lived in Kuwait, and it was a great time of my life, peaceful, and I would say we were spoiled thinking that everything is just going to be steady and stable. And we used to drive by the presidential palace, and there was a sign here, as you can see, written in Arabic, and it says, لو دامت لغيرك ما اتصلت إليك. And as a young kid, I used to try to practice my reading skills, so I would read it, and for some reason, it's engraved in my brain. And when I grew older, I found out the meaning, and this is what it means. It's a proverb. It means if it eternally lasted for others, it would have never reached you. So it's all about a relay journey. I realized the very rich meaning behind that writing on the wall of the palace, that power is not eternal, and being in leadership position or role shouldn't be eternal and forever. You have to learn to hand the torch, and you have to create leaders around you to carry your message forward. So in summary, in terms of my background, I'm a global citizen. This is how I view myself and define myself. Palestinian from Gaza, born in Kuwait, did my medical school in Jordan, immigrated to Canada, my chosen new home, with my husband Kamal, where we had our 3 kids. And I did my radiology residency at University of Toronto, moved to Boston for my fellowship in women's imaging at BIDMC. And I accepted an offer to work there for a couple of years as an instructor at Harvard Medical School. Then I got recruited to work at Saha, which is a governmental set of hospitals at Mafraq hospitals. And this was, again, an amazing experience to help to pay back to the Middle East. And then I came back as a chief of radiology in Peterborough, but I don't know where next is going to be my next step. This summer would mark the 25th year of graduation from the Faculty of Medicine in Jordan. And here are my wonderful classmates. And I'm proud to say that I'm still in touch with some of them. And I just asked some of them about what's the role of their mentors, or what's the role of the mentorship in their careers, because a lot of them have taken leadership roles, whether in Jordan, whether in the United States, even in even in Canada. And the question is that those who were able to answer, all of them agreed that mentors had a huge role in their advancement in their career. After I graduated from medical school, I went to Gaza Strip, where my parents were at that time, and I got the opportunity to work in Shifa Hospital, which is the main hospital in Gaza Strip. And it was such an amazing experience, where I developed a huge interest in women's health, especially in my OB-GYN rotation, where when I used to be on call, I would deliver 9 women per night, and I would see a lot of complex rare genetic diseases. So I developed an interest both in women's imaging, or I would say women's health, and pediatrics. Then I got married and went to Canada with my husband, and I worked as a research assistant at the Hospital for Sick Children. And in the process, I applied for the Ontario IMG program. And here I want to share an important pitfall that new graduates may feel, especially those who work hard and they feel that they're good and proud and confident of their skill sets. They feel like, they should take me. This job is for me, and I'm going to be the best at it. That's great. However, it's very important to do your homework and to do the process. So I applied to the IMG program the first year, and relying on my skill set without really knowing the ins and outs of the process. And unfortunately, that year, they took the top 25 applicants, and I was number 27. I was devastated, and I was very upset. But luckily, I met a wonderful Dr. Elvira, who was from Albania, and she was one of the top 25 that were selected. And she said, Rula, let me tell you something. You're smart, you're good, you know your stuff. However, you have to follow the process. There are steps that you need to take, that you need to be aware of in the Canadian system before you get into the exam and before you get into the IMG program. And let me show you how to do that. So she was wonderful. She told me about the process. The next year, I followed the process, and luckily I was one of the top 5 IMGs that were accepted, and I got into radiology at University of Toronto. Or I would say before that, I had to do kind of almost a 1-year equivalent of medical school at UFT, and then I got into radiology. I finished radiology, and as I said, I was able to get a spot at Beth Israel Deaconess Medical Center to do my fellowship in women's imaging at Harvard Medical School. And that was just an exceptional experience. And a lot of my mentors at UFT, they were telling me it's good to go away. I was worried about, not finding a job if I come back, or, if I'm away, I'm not in the radar for hiring. They said, no, we always like to hire people with different experiences, and will bring something new to the table. So the Women's Imaging Fellowship was so much fun. I was attracted to it because it combines both pediatrics and women's health, as I said, especially the fetal MRI, ultrasound, doing 3D on the babies. And I used to enjoy taking those 3Ds and sharing them with my kids, although especially Southern would find these a little bit creepy. However, they are so cute. I'm very grateful for my program directors for the fellowship, Dr. Levine for the women's imaging ultrasound part, and Dr. Fine Zachary for the breast imaging. I learned a lot from them. And that was the special day on the day we graduated as fellows. And the special thanks would go to my husband, Kamal, who has been very flexible and supportive throughout the journey. The fact that he was flexible, left his job in Toronto, came to Boston with 3 young kids to start all over, finding a job, and even doing his MBA. He did a lot of the heavy lifting for me to finish, and even to take the job at Harvard for 3-4 years before we went to Abu Dhabi. So thank you, Kamal. So I got a job offer after my fellowship to work at Harvard, and I was lucky to have a colleague, Dr. Tejas Mehta, who's also a dear friend of mine. She said, "Congratulations! So have you negotiated your offer?" I said, "No, I'm happy to get a job." She said, "No. This is not how it works. You have good training. You're an excellent candidate. This is what you need to do. You're going to take over a new practice that the hospital now, our group has basically acquired in the community, and that's the job that I accepted." She said, "Yeah, so you're going to lead the practice. So you need the title to be able to influence and empower. So ask for a title to become the director of women's imaging there. And number 2, you need to ask for a stipend. You don't do that for free." I said, "Okay." She said, "Yeah, women are usually shy to ask for the money, but you're doing the work and you should ask for it. And number 3, you need protected time to do this admin work. You cannot do it on top of your clinical work. But never forget your family. Your family is a priority." And she is a mother of 3 wonderful young men now. But like, she was an amazing role model in balancing life work. And she gave me these tips. And until now, Tejas and I communicate. She came to Canada and she gave actually a lecture about breast MRI. She also joined me in Dubai on some of the workshops. I went back and I spoke also at BIDMC about my Canadian experience. So it's amazing to build these kind of relationships and have someone who's been there before you to tell you what to do. So always look for that person in your institution, someone who has been there before you. After I left Harvard, I kept going back and forth for an annual lecture at the School of Public Health about my international and regional efforts to advocate for breast cancer screenings, and that's the chance to connect with my colleagues there. Also, during my work at Harvard, I got exposed to global health, and I developed this interest and excitement about trying to promote for early detection of breast cancer, which is a huge, big part of my work. I got introduced to the team at the Susan G. Comment for the Cure. And I became their director for their Middle East initiatives for a year, during which I met a lot of wonderful advocates and physicians and nurses and technologists working with promoting early detection of breast cancer in the Middle East. And we decided to go ahead and do a study that we run in multiple Arabic countries. And through that program, I met wonderful people. Dr. Sha'lan, who is a breast surgeon and the head of the Egyptian Breast Cancer Foundation in Egypt. Nisreen Qatamish, who is the Director General for King Hussein Cancer Foundation, and who also supported me in a lot of the workshops. And Dr. Sausan Madi, who is the pioneer in her idea of doing a pink caravan screening on the horses. Like people will go around with the horses wearing pink and trying to promote for breast cancer screening. These people are wonderful, and again, they became good friends of mine, and we go back and forth and exchanging experiences. And I appreciate this kind of enriching leadership experience. This is a team of, I would say, advocates, people from different Arabic countries that are working with me as co-investigators on the comparative baseline needs assessment study for breast cancer awareness in the Middle East, and hoping one day we're going to publish our work, because it's been amazing doing multiple workshops, and the last one was actually in 2016, and we're still working on the results. A role model of mine is actually Princess Dina Merid. Actually, she's deserved to be a doctor for the amount of knowledge that she knows. She is a princess in Jordan who was working at King Hussein Cancer Center, leading it at some point. And now she is the president of the Union of International Cancer Control. She was the first Muslim to have been elected to lead such a prestigious global post. I got to meet Princess Dina at Harvard when she was invited as a keynote speaker for the Harvard Global Initiative. And one of the statements that she said and resonated with my vision and mission is that when she said, having the chance to live should not be an accident of geography. To me, this meant the world to me, because that's exactly what I was trying to do. Everybody deserved a chance to be treated well and have a good health and have access to health, and should not depend on geography. And her mission is along the same lines when it comes to improving cancer care in the Middle East. And until now, I check with her, like I'm doing a project through my MBA about starting a digital cancer center in the Middle East. She got so excited and she said, Rola, you need to talk to this and that, and let me connect you, and this is going to help women across the world, not just in the Middle East. Let's do that. So she's the type of person who would get excited and do something about it and take action. So thank you, Princess Dina. To tell you a little bit about what I do, I am a community radiologist, and which means I do everything. I do MRI, CT, X-rays, ultrasound. However, my passion is breast imaging. And here's a mammogram that shows a woman that has been screened in June 2019. And as you can see here, it's all gray, which means that's good. It's fatty breast, and there is no white spots or lesions, which usually represent cancers, and sometimes, of course, breast parenchyma. She came back in December 2020, and for those with astute eyes, you can see that in the right breast, she developed what I would call an irregular mass with calcification. She had an ultrasound, and there is an irregular mass. We did a biopsy, and this mass is enhancing following injection of IV contrast, and unfortunately, this was a cancer. So with this breast multimodality imaging, we help diagnosing her cancer, I would say early enough that it is small, probably not palpable, because she has a good sized breast. It would be hard even to palpate that, and mammogram would be the best way to diagnose it. So breast cancer screening and early detection of breast cancer saves lives and improve patients' outcomes. I want to say one quick word about breast cancer in men. It is rare. It's less than 1% of all breast cancers and may happen. This is a 60-year-old male patient, and I just wanted to show you how cancer looks on mammogram. It's speculated some calcifications, and we put that triangle on the skin just to show that this is the area of palpable lump, and unfortunately, this was a cancer. What's exciting about breast imaging that it also involves interventions, which means we do biopsies. The biopsy can be under ultrasound guidance. So we give local anesthesia, and the patient will be talking to you and telling you how she feels, and here's the needle going into the lesion. Or under mammography, we call a stereotactic biopsy, and we do this specifically most of the time for calcification that we cannot see under ultrasound. Additionally, because we do breast MRI, sometimes we see the lesions on MRI only, and we end up doing the biopsy under MRI guidance, just like this woman here. We compress the breast with a grid, which will help us exactly locate where the lesion is and put the needle in and get the samples. And here are the samples of the breast biopsies. We send them for pathology, and the pathology would let us know if they are benign or malignant. As Sausan said, my daughter, that I decided to go back to school and do further studies. I always was impressed about the business side of healthcare. So now I'm doing my Global Executive MBA in healthcare and life sciences at Rotman. And I started in October 2019, and hopefully we will finish in August 2021. It was delayed. We were supposed to finish in March, but because of the pandemic and the delay in some of the modules, we moved it to, it was moved to August 2021. It's been an amazing experience, and I particularly joined because I do feel that artificial intelligence have a major role in the future, but I also am a strong believer that the human touch is the most important in the context. During this experience, I got to take an elective called Creative Destruction Lab at Rotman. And in that course, the students get matched with a venture, a startup company. And the company that I'm working with, again, I went back to my old passion. Really, you have to feed your passion. And then now I'm working with a company that's working on a treatment for rare genetic diseases. And I thought it's an opportunity to share with the students here who are listening. There is a program at Rotman for free that's called CDL Apprentice Program. The program intention is to address the gender gap for girls 14 to 18 years of age. The students would register and attend theme-focused modules including artificial intelligence, agriculture, climate, oceans, matter, and health. All program modules are delivered virtually and require a 2-hour time commitment and approximately 1 hour pre or post assignments. The students who complete 3 modules will receive their CDL Apprentice badge and a letter of achievement. And upon completion of 4 modules, CDL Apprentice grad status is granted. I think it's a great opportunity. I'm happy to share the link below with Emily, who can pass it to those who are interested to sign up. I think the program will start in February and extends until May, and you can choose whatever module you can. I highly recommend it. Let's move on to talk about women's leadership. But as Sheryl Sandberg correctly said, in the future, there will be no female leaders. There will just be leaders. And I think this is very important to keep in mind. I also would like to share some of the challenges that I faced during leadership and how we can turn them into opportunities if we can. It is definitely an overwhelming experience, but with experience, you would learn how to cut those big tasks into smaller pieces and tackle them based on a priority. It's important to commit to deadline and finish the work and celebrate and reward yourself. Also, you would ask yourself, what if? There's a fear to fail or regret. However, the only way you would know is by trying. And from my experience, I feel it's a privilege to come closer to the things that scares me and I'm fearful from, because you'll get to see better and learn more. And at the end of the day, to be honest, there are no regrets, only lessons learned. If plan A didn't work, always make sure you have a plan B. The idea is just to keep moving. Few words on importance to watch for signs of burnout, especially during this challenging time of COVID and COVID fatigue. Despite the fact that some women in leadership feel that they have to work harder to prove themselves, really this is not necessary. Your work would show, but I also would like to talk to the students who work so hard and they need to watch for the signs of burnout, not just for themselves, but also to learn to see what their friends and their classmates are going through and spot them. And it's okay to go and ask if they need help or how they're feeling, and maybe offer some advice. If you're embarrassed, maybe you can tell your teacher about that. There are so many ways that you can tackle this and try to figure out if your colleagues at work or if your classmates or whoever is around you in your circle, it's very important to realize this mental health status that may drain you and get you to do stuff that you really don't want to. So take a break, unplug every now and then, try to figure out what's the best balance for your work and life. And it's different from one person to the other based on their background and culture and values. You need to spend quality time with family and friends, and most important, with yourself to reflect. Nurture little sparks in your life, probably like a new hobby. It's interesting. I find in COVID that lots of people have decided to learn new things because they found out that their career that they're doing right now probably not essential within this pandemic. A lot of people went to learn more about online jobs and how to do virtual digital technology. So keep an open mind. I also got to meet an interesting and wonderful group of Canadian women physicians, originally from the Middle East, and I've been part of their social media circle, and I did throw in that question about the role of mentorship in their careers, and all the 25 responding doctors agreed on the importance, with 92% strongly agreed that mentors are very crucial for advancement of women career. So why do we need the mentors? The mentors are important they can shape our decisions without changing our core values because they will understand what we're going through. They look at the big picture, so they can offer you the expert opinion. Also, they can offer honest advice without you feel intimidated. It's a constructive criticism. And if they don't know, they can refer you to someone who would know. And that would increase your network and it will open doors. Also, they can offer some tools to help and set realistic expectations, just like what Stephanie did for me. She said, yes, you're going to go to RSNA, you're going to speak, and I'll help you. So I felt going through that experience, she got my back. Like, even if I don't know, I have someone to ask. They've done it before. They will always find time to chat with you. They're never too busy to listen. However, be smart about when to ask them to speak to you and to find time with you. They genuinely care and they do timely check-ins with you. And the best part, they're not threatened by your success. They're proud of you because basically a good mentor is someone who is going to create leaders. I would say like leaders, mentors. They like to create leaders like them because it's just a sign of their continuation and their legacy. Now, how to find a mentor? You need to choose wisely. First, figure out what you really want and what you aspire and what is it that you like to be, and look around in your institution, in your school, at your work, at the hospital, whatever settings you're in, find someone that you look up to. And it's okay, go and ask for a meeting and have a coffee and see if this is someone that would resonate and align with your values. If you get the opportunity to work with them, that would be great on a project or volunteering. You'll get the opportunity to get close and see how they treat you and treat others. I found that best mentors are those who talk more about their mistakes than their achievements, because they'll show you and help you spot the pitfalls and the roadblocks. You can also go and ask successful people that you admire about their journey and who helped them to get where they aspire. Remember, it's a mutual relationship. You can have as many mentors as you want, so you don't just do one mentor. You can have at different stages in your life and different aspects, you can get different mentors. Make it worthwhile their time and their time investment. It helps if you underpromise and overdeliver to surprise them. In the past, I think a couple of years ago, I came across this book when Mariam was shopping around in chapters, and then I found this book and I read it for Keith Firazi. My takeaway from this book was the following. Life is give and take, obviously, everybody knows that, but we need to change our mindset to view a request for helping others as a future investment and opportunity to expand our network. The reward may not be instant, but we should trust that good deeds are never a waste, and after all, it feels good. Don't be shy. It's okay to ask and to offer for help. As Prophet Muhammad, peace be upon him, he said something that's very, very important, that the cure of confusion is simply to ask. Just don't live with confusion. Try to ask for help and to see if you can get an answer. What do mentors expect from mentee? It's very important when you're asking a question. for your mentor is to come with an open mind and you're truly interested in listening to them. Don't go there just to validate what you already have made up your mind with. Go and listen and try to learn from your mentor's mistakes. And give it your best shot and work hard to stay on course. Keep them posted with your successes and celebrate together to make them proud. And most important, you have to pay back by helping others, particularly those referred by your mentors, because it's very common that they view you as a role model. And it's very common that your mentor may become your peer, and that's very common in academia. And it's from grit and gratitude, and the relationship would be amazing because there would be mutual support and respect. However, it's time to develop your own internal advice engine. 2 weeks ago, I had my fourth module in the MBA, and one of the politicians was invited to speak to us as a guest speaker. He was youngish and very enthusiastic, talked about the health policy and how he jumped from academia into working into the Obama administration and now on Biden administration, and how he's really aspiring to make best practices and change health policy accordingly. And all the questions in the session were around the health policy. But then I asked him, knowing that I'm going to give this lecture, I said, what sort of strength you had that allowed you to go to where you are? And the first thing he said, my mentors. And he said, but remember, it's very important to remember that your mentors are going to be your peer, and you have to develop your own reflections and get your internal advice engine. And so this is what he said. I didn't come up with this. It's his words, and I wanted to acknowledge him. But that also resonated very well with a habit that I have in terms of reflection. I like to write my journals and diaries. I started at the age of 9, thanks to my mom, who used to write her own diaries. And I came up with 7 Ds. And in terms of reflections, when you write your diary or your journal, you get to document. You document everything, correct? It's like a sketch. And then slowly your thoughts can be decluttered from what's important and not important, and you start to dream. Once you dream about something, you decide to do it. You make a decision and then you do it. When you see that you can do it, then you succeed. Why don't you even try to aspire higher? Like, not just going to Harvard. I supposed to be speaking at RSNA. You dive deeper and then you dance and celebrate. So I'd like to thank my mom and make sure that you guys get the take home from this talk is, please do pay regular visits to yourself. It's very important. And I'm going to talk about the relay journey and consider this as a road trip. First, identify your purpose. After that, you start your engine. But it's very important to choose your team players to make sure that even if they come from different backgrounds, different capacities, but you all have to have the same mission. We have a saying in Arabic that says, "Al-Rafiq qabla al-tariq." So you choose your companion before you choose your path. But also you have to consult the map to ensure you're staying on course. So make sure, again, you go through the process. Make sure that you are following the course. Also ask for directions. So mentors and experts are very important, with the awareness that there are some dangerous curves, hazardous roads, detours, and sometimes the road is under construction. You'll have some road rage. You have to accept all that. This is just the nature of life. It's not an easy path. But there's a very important thing. Remember the tune-up and the maintenance. Sometimes you'll be the driver. Sometimes you'll be the passenger. And that's where the relay journey comes. You need to give chances for others to drive the mission. And it's all about the journey, not the destination. So please enjoy the ride. And there's this very lovely proverb, African proverb, that I go by all the time. If you want to go fast, you go alone. But if you want to go far, you go together. I'd like to also talk about women's leaders and how they have to break the stereotype. They don't lack assertiveness or risk-taking when necessary. Also, they work on reducing general disparities in their organizations. They would support and speak up for other women to break the queen bee phenomena. Also, effective women leaders inspire other women to become leaders with the role model effect. And most importantly, they provide the enablers. They pave the way for successive women leaders and they encourage diversity. I'm so proud to say that I'm part of a team at PRC that have a lot of women's leaders. All of them are inspiring, and particularly my wonderful colleagues and friends, Leslie Highway and Nancy White. They're amazing, and they are very supportive of women's leadership and the women's health. And I really, really appreciate the opportunity to work with them. I'm so proud of being calling myself their colleague. I don't want to forget the role of men support in women's leadership. They're very important. Don't get me wrong. I talk about women's leadership, but I do feel men have a huge important support. To the extent that when I was in Harvard, I saw that there was a leadership award for advancement of women faculty career. And I went back for the sake of this talk and so who won the award in the past 10 years, and 6 out of the 10 were men. I wasn't surprised. Men can help close the gender gap, the gender pay gap. They can acknowledge and understand challenges facing women's leaders, and they'll then help breaking the barriers to career advancement. With that, I'd like to also acknowledge my men or male mentors. I'd like to thank Dr. Walid Abu Ramadan. He's an OB-GYN in Gaza who helped me develop my skills and my interest in women's imaging. Dr. Muradelli, who's the head of breast imaging in Toronto and has been a great support throughout my career, and Dr. Max Rosen, who was my boss and my mentor when I was at Harvard, and until even this time of the talk, he always supports me and finds way to advance my career. Also, I'd like to thank my family and friends. They're always the reason for my inspiration. Without them, I couldn't have done it. So in summary, I'd like to say that women's leadership is about elevating women's status, helping them fulfill their potentials, and help other women to pursue their passion. Mentorship is crucial for effective leadership, particularly for women where gender disparities exist in multiple leadership roles. Both female and male mentors can make a difference in their female mentees' career and life, where they can influence and motivate based on understood core values. Mentors may provide a holistic advice encompassing physical, emotional, social, and spiritual wellness. Life is give and take, so please ask for support and offer help when you can. Lift others, any small act counts. Have a backup plan and know your alternatives. Also plan to unplug and spend quality time with your family, friends, and yourself. Remember the 7 Ds of reflection, from document, declutter, dream, decide, do it, dive deep, and dance. And before you give up, notice who's watching. I'm not going to say leadership is easy. It's very hard. And a lot of times I feel about quitting. Why did I do that to myself? But then I thought about I noticed who's been watching, and I decided not to, because I have little Simpas at home watching me. Thank you very much. And now it's time for questions and answers.
Thank you so much, Rola, for that very, very inspiring talk. My name is Laura Elliott, and I'll be moderating the question and answer portion of the night. So you can start typing your questions into the question and answer box when you feel ready. I'm a guidance counselor here at Lakefield, and I'm on the Wadsworth House team with Rola's daughter, Sasan, who I am a big fan of. I also have a vested interest in girls' health and leadership, although through a bit of a different lens. My PhD work focused on helping girls find their voice with respect to navigating body issues and confidence in school. Hearing and seeing other women like you, Rola, empower girls and women from your position is so inspiring, and I'm so happy to be part of this evening with you all. So with that, let's jump into your questions. There's none yet, so I'm going to ask mine. Rola, would you say that having a family early on in your career is a downfall or more challenging? And if so, what were some of the challenges you were presented with, and how did you overcome those?
A very good question. I would say having a family early in my career was actually a motivation and important support. It wasn't easy, obviously, to be a physician and a resident and taking call duties while you have a baby at home that you have to take care of. But it gives you the reason to work harder and to get organized. So I wouldn't say at all starting a family will get in the way of the career, but I do think it's important to plan and try to get a good support system. I did ask my mom to move close to us and to help me. We were able to hire a wonderful nanny who's now part of the family and a close friends for us and the girls and Ali as well. So it's important to plan it right, to enjoy the family and the work.
Thank you so much. That's very helpful. You do need a support system when you
Absolutely.
take on these roles. There's no questions in the question box. Emily, I don't think you see any either.
That was very clear.
You covered everything. Rola, we want to thank you so much for taking the time tonight to speak with our community and for inspiring us with your amazing background and work. You truly are an inspiration. As a guidance counselor at Lakefield, I know how important it is for our students and especially our girls to hear about women who have blazed trails for them in fields such as medicine. Because you have paved this road, our girls know they can walk down it too with some hard work. As you know, having a mentor is so invaluable for us and our girls as we work to find balance, joy, and success in our lives. Thank you for providing us with the tools to navigate these important relationships. I want to thank you personally as a professional woman and mother to young children. It's easy to feel overwhelmed by those push and pull forces for women as we navigate pursuing a career and caring for our children, now more than ever. Your words are meaningful and your advice appreciated more than you could know. It's the truth that women often won't take that leap into leadership. And as you said, you won't know until you try. This ethos is so important for my generation and for the next generation of women as we work towards a world where there are not female leaders, but simply leaders. So thank you for modeling that.
And
it's
one question coming. So hold tight, Rola. Don't go anywhere because this is actually a really good one.
It came in right as I started, and it's a great question. So let's keep going. Do you have any recommendations for overcoming the stereotypes of being dismissed in a male-dominated environment?
Interesting. I think the most important thing is to be present. Make sure that whatever it takes, whatever you, like, even if you don't feel safe or you don't feel this is the right spot for me, if you have to be there for your work, for your family, for advocacy, just go and sit there, sit at the table, speak up your mind. And if someone interrupts you, just let them know that they are interrupting and you continue talking. It's very important to set the game rules right from the beginning. And you know what? I find it very helpful to have someone else at the table that you can connect with before, or even in an organization, to get your back and to have your back. And just if someone is preventing you from doing something, that person would call on the other person who's preventing you from doing your thing. So you need some advocates around you. So it's not just you doing it. You need a team of whether other women, other men. It doesn't have to be a woman like you, but like women get a sign of sisterhood thing. Women get to help each other. But I also found my male colleagues who believe in equal opportunities for both genders. They would, step up and help other women. So I'm not sure if I've answered the question correctly in terms of the stereotypes, because men tend to think that women, if they dominate the environment, women would tend to take a side and sit at the back. But to break that stereotype, you have to be there in their face. That's what I would advise.
Such good hands-on advice for the workplace. We have some more questions rolling in. I'm going to go down the list. So what advice would you have for young women who are seeking mentors early in their careers, perhaps before they have a clearly defined direction?
It's never too early to have a mentor. You always have to have a mentor, even as a high school student, as middle school, it's always nice to get the opportunity to talk to someone that you look up to. So my advice is to find couple of people that you really would like to hear their advice. And you know what? Sometimes you'll be lucky. You just tell that person what you like, and they say, "Oh, you know what? You would be a good fit for this path. Sounds like you're that type of person." So they will shape your path for you. Now you don't have to actually listen to them at the time, like, and do it, but it's nice to know because they have the expert and they can see something based on their expertise. So I would highly recommend speaking to others who are successful and that you like to be like them, and let them know what you like, and they can direct you on which path to go.
Absolutely. And we have one final question. Have you ever had to confront discrimination? And if so, how did you find your voice and use your voice?
I did. You know, being a pregnant resident during residency program was not easy, especially if you get pregnant twice during a 5 years residency program. So some of the unfair comments that I've heard that, oh, you may not do well because you are pregnant or probably because you have a baby. So to me, that was kind of discrimination based on the fact that I'm a woman, I'm pregnant, I have kids. And I asked that person, first of all, for an apology, and I asked them to judge me based on my work and my outcomes, as opposed not based on my gender and what type of family I have. Like I remember even as a joke, one of my colleagues, so I really like he said, "Oh, you're a baby machine." I said, "This is totally inappropriate. You can't say that to me. One day you're gonna have your family, and I think it's just my choice to do it during residency." So you just, you know what, sometimes you can say it jokingly, sometimes you say it bluntly. It depends on the context, correct? Like the idea is not to make people feel bad. My point is to make them feel aware so that they don't do it again.
Thank you for that. There's a couple more, and we have 10 minutes left. So you mentioned core values several times. Can you tell us about the core values that guide your decisions and career?
Oh, interesting. Well, I mean, I have my own core values. Core values are different based on the type of person, the type of culture, the beliefs. So I think the most important core values is that one of the most important core values of mine is that my freedom in any practice I do would stop when it is invading the zone of freedom of someone else. That's very important to define in whatever you do. Just make sure you are not stepping into someone else's comfort zone because it's something, this is the way you like it. So that's one of the most important core value. Also, you have to treat everybody with respect, because that's, if you want to be respected, you have to respect people. That's the only way that you can force others to respect you back. And one of the most important core values is that my priority is my family. I remember again during my residency and being again a pregnant woman, I've been asked by one of my supervisors, like, what's your priority? Like, is it, you have to define your priorities. Is it your family or your career? And at this stage, probably it should be your career, not your family. I said, I'm sorry, I don't think so. I disagree with you. My family is my priority because my career is about making my family a better family that would contribute to the society. If my career doesn't add to the nourishment and the wellness of my family, I don't want that career. But I'm telling you, I'm going to be able to build a career and a family as long as I can find that balance.
That's such an inspiring message for women coming up below you. So thank you.
Yeah. They can do it.
One final question. Were there any challenges in being an international medical graduate?
Oh, yeah. Yes. Being an international medical graduate wasn't an easy thing. I would have to say I got lucky because I was a new graduate, so I didn't have to go and repeat a lot of my training. So I went directly into residency. I just had to repeat 1 year of medical school. But other international medical graduates, you know, they come fully specialized from their home countries and they have to retrain. Now, I do understand that the process is important for transitioning and to fit into the culture. So to me, that 1 year was very valuable. For example, I didn't know how to take history from a psychiatric patient who speaks different language and have different beliefs and have different delusions. And you know, so it was very important to go through that year of introduction into the Canadian culture, the diverse culture, especially if you're coming from a culture that didn't have, or a country that doesn't have multiple nationalities. I would have to say I was lucky because Kuwait was multinational as well. Like there are a lot of people with different backgrounds, so the transition was a bit easier. Also having some language barriers, and with time, these challenges, you can overcome them, but also the same story for all the immigrants that coming to Canada. We come leaving a lot of baggage, with some baggage, but like I'm leaving my parents behind and I feel like we're too far away and we miss family. So it's very important when we come here to feel we fit in and we're welcomed. And this is like actually new home and we have new families and new communities. So I guess you find the right people, the right spot, and this is why I feel very happy and proud to be part of Peterborough and the community and the LCS. It's such a diverse community and global community, and I guess this is how you overcome these kind of challenges as IMG.
Thank you so much, Rola. We have time for one more question, so I'm just scrolling through to find one. So what advances in radiology should people be interested in this field, and what should they be watching for?
Women's imaging, obviously. You know, I do like, in terms of advancement, I think the most exciting part about radiology is interventional radiology. The fact that we can do procedures without putting the patient under full anesthesia and provide almost similar and sometimes even better results is just an amazing opportunity to improve quality of care. So watch out for that and for the technologies there. The other things that I feel it's going to have a big role is the integration of artificial intelligence with imaging, and how would that the impact of the workflow in the future. But definitely, if I would have to pick something, anything related to interventional radiology.
Thank you so much, Rola. I would love to read my whole speech to you again, but I will not. And I will just say thank you so much from LCS for joining us tonight and sharing your expertise and passion. You have a humility about you, yet you've accomplished so much. We're very, very lucky to have watched you speak tonight and answer our questions. So thank you so much.
Thank you so much for having me.
And good night, everybody.
Good night.